So plug procedures, the use of large grafts, which were popular in the 1960s, 70s, and early 80s, are what gave hair transplantation its bad name in the old days, gave the doll's head or cornrow look. Unfortunately, the hair from those grafts continue to grow, and people that had cosmetic problems from those procedures still have them today. For a number of years, we tried camouflaging them. When we developed new transplant technique with smaller grafts, we tried putting the grafts in front of these large plugs to soften them and make them look more natural. The problem is that the grafts would actually still stand and be visible through the more naturally transplanted hair. So over the years, we tried to decrease the size of the grafts and convert them essentially to smaller grafts. It turns out that this also is really not that effective. And the reason is that most of the grafts that were placed were not only in clumps, in grafts that contained too many hairs, but also the hairs were in the wrong direction. So it's best to totally remove plugs if you can. When we remove them, there's two things that happen. One is that we can reuse the hair, and when you capture the whole plug, you actually get to use all that hair. The other thing is we don't have any remnants of the plug that has poor hair direction. And equally important is the plug is actually sitting in scar tissue. And when you remove the entire plug, you can actually close the defect, close that little hole with skin that's normal. So you can create this kind of lumpy cobblestone skin into much more normal appearing skin. The hair that we get from a plug, we can reuse. So we take the plug, we put it under a series of microscopes, and just as we were dissecting a donor strip, we can dissect the follicular units out of the plug. So we'll take that plug and convert it into 1, 2, or 3 hair grafts. Then we'll use those finer grafts to put around the old plug sites. Generally, what we do when we're repairing plug procedures is we'll use the hair that's obtained from the plug in the central part of the scalp as a filler, because the scar tissue around those plugs actually can make the hair that we get from the plugs a little bit wavy and unnatural. So we use that kind of as a filler, and then we take fresh hair from the donor area, and we use that to recreate the hairline and make the transplant much more soft and natural. So in summary, in the old days where we tried to work around plugs and camouflage them, now we find it best to totally remove them, put them under a microscope, dissect them into smaller follicular units, and then re-implant them the way hair naturally grows.